Okay, we're now going to speak to Dr. Mufaddal Hamadeh, who's the president of the Syrian American Medical Society, joining us from Chicago. Thank you for your time. So the war over the past 14 years has devastated the country's infrastructure. What is the state of the health system today, as you understand it to be?
Wow, the healthcare system, as you said, is decimated through years of neglect and years of total decimation of the healthcare infrastructure. The healthcare system in Syria is divided to two sectors. One is a private sector and the other is a public sector. So public hospitals are debilitated and it's actually now more than ever they're in trouble because of there is a shortage of supplies and most importantly, shortage of staff. Shortage of nursing now. A lot of nurses have fled and they have went to their villages. So at this point, they're making a bad situation even worse. Some doctors have not gone back to their work, and the civil society has not been able to pick up some of the problems left behind from the shortages in the public sector. Overall in Syria, I think the main problem is after many years of dictatorship, civil societies have not been able to develop. They were never given a chance to develop and they were never allowed to develop. So a lot of what they need to do now in Syria is quickly develop civil services that will be able to carry on some of the...
what should be the priorities right now in terms of beginning to rebuild the health systems?
Right. The rebuilding process is going to take a long time, but for now, the number one priority, in my view, is psychosocial support, particularly for the thousands of prisoners that were released recently. How you're going to be able to rehabilitate those prisoners, and not only that, but its effects on the society. For every prisoner that was released, there are thousands of families that are grieving today because their loved ones could not be found, or even if they knew they died, their wounds have reopened again. And you have a lot of grieving and a lot of uncertainty how to deal with the trauma that the Syrian people has endured for many, many years. And I think, to me, that is the number one problem that we need to address now, and to look for long-term solutions on how we're going to be address this problem and how we're going to be able to create teams for reconciliation and kind of healing process of years of depression and basically oppression.
And of course, Dr. Hamadeh, international sanctions on Syria remain in place. The International Crisis Group writing on X that Syria is one of the most heavily sanctioned countries in the world. What would leaving these sanctions in place mean for Syria and the health system?
Well, the sanctions on Syria always excluded the humanitarian aid. I think the problem with the previous regime and humanitarian aid to Syria was mainly corruption. The aid was not going to the right places. A lot of it was subject to nepotism and subject to bribes and extreme corruption. So I think that has to be reshaped right now, and the international community has to be able to deal with different players now, the players that are going to be able to deliver that aid to the people who deserve it most. I think it's a big mistake for the humanitarian sector, humanitarian aid providers, NGOs, international NGOs, to stop working right now. The other issue that it was affecting basically humanitarian aid is overcompliances from banks. Even though humanitarian sector was excluded, but many banks did not want to deal with did not want to take any chances of being one day accused of violating sanctions on the U.S. on the Syrian people. So sanctions now should be lifted, I think, anyway, because I think they need to allow the new government, the people, to be able to find ways to rebuild their lives again.
All right, Dr. Mufaddal Hamadeh, president of the Syrian American Medical Society, thank you for speaking to us from Chicago.
You're welcome. Thank you for having me.